This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Hey, good day, everyone. Welcome to the February 2019 edition of the Best Health Community Podcast. We are launching our new series. Last month was with Dr. Jamie Ard, and we're very fortunate to have Dr. Twomley visiting us this month to talk about all things heart health, cardiovascular disease, reducing risk for cardiovascular disease. So we're very excited to have her as our special guest today. And then we'll be touching base on a couple of other items a little later. But I want to jump right in and start talking with Dr. Twomley. So Dr. Twomley, how are you doing?
Good. How are you?
Good. Welcome. Thanks so much for taking the time and participating with our Best Health Podcast. So you're cementing your name in history. This is our second podcast ever.
Great.
So it'll be part of your archives for decades and decades to come. So talk to us a little bit just about yourself and how you, down this path of we call life, how you ended up being a cardiologist.
Well, I graduated from Wake Forest Cardiology Fellowship in 2010 and signed on in Lexington. And I've been here ever since as a community cardiologist, and I've very much enjoyed my time. So I chose cardiology as a profession for a few reasons. First, I was attracted by how lifestyle can influence disease onset and outcomes in cardiovascular disease. And I enjoy talking to patients about positive lifestyle changes. Second, cardiology has massive amounts of research driving treatments that are effective. So death and disability from cardiovascular disease has declined significantly over the past decades due to these medical advances.
And did you go to Wake Forest as well?
I did.
Go Deeks!
I graduated from Wake Forest Fellowship
Yes.
and then started working as a community cardiologist in 2010 in Lexington.
Very cool. Yeah, so that's the fun part about being part of the Wake Forest Baptist Health family is we're very fortunate to have medical centers and locations all across Northwest North Carolina. We are taking a field trip this month to Lexington where we're hanging out with Dr. Twomley. So you might hear that from time to time on the Best Health Podcast that we're visiting some of our different locations all across Northwest North Carolina. So we're excited about that. Dr. Twomley, it's and I'm one of the marketing guys, so I'm not a clinician or a medical expert, but just kind of thinking about your heart, it's this obviously very important organ in our lives that we can't live without, and it's working every second of every day of our whole life. But at the same time, because of that, it kind of gets put in the back of our mind and maybe not at the forefront of, I don't think 8 times a day about my heart. So I think a lot of consumers and patients or potential patients might think the same way. So how do we help raise awareness about some of the risk factors that people might need to keep an eye out for them to say, hey, maybe I should visit my primary care or make an appointment? What are some of the main risk factors or important pieces of information or numbers that us as consumers and patients should pay attention to since we're not thinking about our heart every day?
Well, I feel like awareness has improved greatly over time. Most Americans will be able to tell you that heart disease is still the number one killer of Americans, as well as most developed countries. It's the number one cause for death and disability. Mm-hmm. I think that the problem we still have is that people aren't keeping it in the forefront of their minds when they're talking about or thinking about their health from day to day.
Sure.
So we all want to live long, enjoyable lives. And what we need to realize is that while it's an effort to keep your heart health up, that's going to allow you the best chances to do that. In terms of what we need to think about for risk factors for heart disease, certainly your lifestyle when you're young in terms of how much you exercise and your diet and your keeping a lean weight are important. Mm-hmm. But other risk factors as you age, like diabetes and hypertension, high cholesterol, whether or not you smoke, are all very important also. And all of these things are modifiable. So we have treatments that work very well to help prevent cardiovascular disease if you should take those on.
Right. So that's a great point. Talking about some of the pieces that are modifiable, and sometimes we'll hear questions of, well, it's partly genetics or versus environmental or lifestyle. So maybe can you talk about that a little bit about how much of it is genetics versus how much of it do we have in our control and should be aware of and keep up on a more regular basis?
There certainly is a genetic component to this. I see a lot of patients who have done everything they could with their lifestyle, but because of their strong family history, they end up with some cardiovascular event or cardiovascular disease. That is something to keep in mind because those people who know about their family medical history maybe want to establish with a cardiologist earlier. They might want to get a stress test even if they're not having really significant symptoms. Sure. And they have to be really careful to look for symptoms earlier than their colleagues who may not, without a strong family history.
Gotcha. So if we're going through our days and I'm busy and I'm working and I got to pick the kids up and I got to do this and that, so this thing called stress enters our lives, and stress ebbs and flows with different life experiences and life situations. Maybe speak to that particular topic of stress and how it could impact our cardiovascular health in some ways to help keep that in check for us.
Well, that's interesting that you say that because that's one of my topics that I discuss with my patients all the time. Mm-hmm. There are 3 lifestyle modifications that I feel are important in terms of cardiovascular health. The first is exercise. And exercise has the best data in terms of its ability to lower your cardiovascular risk. Now, the AHA guidelines for exercise are 30 minutes of moderate intensity aerobic activity most days of the week.
Okay.
And 30 minutes isn't that long of a time to carve out of your schedule each day.
Nope, it's one TV show on Netflix.
Exactly. The second that I talk about is a heart-healthy diet, which is essentially a Mediterranean-style diet.
Okay.
So this focuses on low saturated fat consumption. So avoiding fried foods, avoiding fatty meats, and high-fat dairy, but focusing on unsaturated fats, so olive oil, nuts, fish, avocados, also focusing on fruits, vegetables, and whole grains. Okay. Third is de-stress. Mm-hmm. But you can't just remove the stress from your life, so you have to figure out ways to cope better with stress. What we know about stress is that it causes inflammation in the body, and inflammation then leads to arterial damage, and arterial damage leads to plaque formation, which is cardiovascular disease. So the less inflammation in your body, the better.
Gotcha.
Stress being one of those things that causes inflammation.
Gotcha. So I obviously there's a correlation with, exercising helps reduce stress and all that fun stuff, correct?
Exactly, yeah.
Yeah. Well, so the heart is an extremely complex organ. It's connected to a pretty complex cardiovascular system. And like I was saying earlier, we don't I think some people might think, I don't have to worry about my heart unless I have a heart attack, something major happens. Otherwise, it kind of does its thing in the background. So why would someone need to pay attention to their heart condition, to their numbers, before they have a heart attack, I guess? What are some of the important numbers they need to just be aware of if they're looking through? Obviously, probably cholesterol is one of them. What are some others?
If we're going to talk prevention, you want that to start as early as possible. Mm-hmm. If you have really high cholesterol until you're 50 and have a heart attack and then you change your lifestyle, that's not going to be as good as if you started at 20 and prevented the heart attack in the first place,
Sure.
obviously.
Yeah.
So the numbers that we look at, certainly blood pressure and cholesterol. For blood pressure right now, the current guidelines want people 45 and less to be generally in the 130/80 and less range. Mm-hmm. The guidelines now say that as you age, we can allow a bit higher blood pressure. So 45 to 75, our goal is to be about 140, less than 140 and less than 85 on the bottom number. Mm-hmm. And then for people over 75, you can go a little bit above 140 permissively.
Okay.
For cholesterol, really we're talking about total cholesterol and your HDL cholesterol, which is your good cholesterol. Those numbers should be checked, and your doctor knows the ratio that you should have for your total to HDL cholesterol.
Sure. Now, tell us again which one's the good one, because I always get those mixed up.
So HDL is your good cholesterol. And for men, you want that to be greater than 40. But for women, you want that to be greater than 50 because women's just tend to run higher in general. The bad player in cholesterol is the LDL cholesterol.
Okay.
We've gotten out of favor of focusing on the LDL cholesterol numbers as a goal, but I'll tell you that I still do in my clinic because there is a lot of data behind it. Mm-hmm. So an LDL cholesterol of greater than 130 is considered high.
Sure. Now, when you have patients come in and see you in clinic, how do they come to see a cardiovascular specialist or a cardiologist? Because, maybe some people are like, well, I just need to see my regular doctor sometimes if I get real sick, or I wouldn't really need to ever see a cardiologist unless I have a heart attack. Then they'll send me to the cardiologist. So maybe talk about just kind of the different types of patients that you see in your clinic, and some of the wide range of issues that you see in your clinic, and it's always not just right after a heart attack.
Right. There's lots of reasons to see a cardiologist. Symptoms-wise, of course, chest pain is the first thing we think of, but often shortness of breath is the first symptom of heart disease, even of impending heart attack. Dizziness, passing out, leg swelling, all those things are reasons to see a cardiologist. I see patients from 20 years old who are having, too fast of a heart rate for certain reasons, mostly young women. And then, of course, valve disease in the elderly is a normal process of aging. Okay. And so I see elderly with heart murmurs. Okay.
So it's a wide range of patients with a wide range of different issues that affect the heart, I guess, is what we're looking at, correct?
Correct.
Yeah, so looking at, I think for some patients out there or some consumers, the idea of going to see a cardiologist means something serious is happening.
Anxiety-provoking.
Yes, yeah. It's not. Maybe I'm trying to delay that or put that off because then I have to admit to